welcome to another chapter of Ask Professor Revel. And today we have a special edition, and I'm very happy to host Efrat Carmi. Efrat is the CEO of the Israeli ALS Association. Hello, Efrat.
Hi, good morning. How are you?
I'm well, and you?
I'm very good, thank you.
I wanted to discuss with you issues regarding invasive respiratory help for ALS patients. And could you tell us what are the pros of invasive ventilation?
When an ALS patient starting to feel breathing problems, they go on a non-invasive, and then when the non-invasive is not sufficient anymore, they need help or decide to go if they want to go on invasive ventilation. The pros will be that they will not experience any more breathing problems. It's a big relief for patients, and their life expectancy will be longer. So they will stay here with their family and loved ones more, at least few years more.
So this sounds very good. However, I understand that there are some cons to such a decision.
Yeah, it sounds very good, but you have to take into consideration that the quality of life will be lower. This equipment of invasive ventilation is very highly maintenance. It's a 24/7 maintenance. There always need to be someone around the patient. They cannot be left alone. Going out of the house will be more difficult. So it comes with a lower quality of life that should be considered as you go into this decision.
I understand that there are some pros and some cons, that you prolong life, however, life quality is lower. And I also understand that there are country-to-country differences. And could you explain about the ramifications of such a decision from the legal and country-to-country decision-making?
Yes, Israel, that where we live, is very unique on this subject, because I think it's the only country in the world that if a patient goes on ventilation, he cannot get off the ventilation. Other countries, as the US, Canada, Europe, Australia, and other countries, when a patient decides he had enough, he doesn't want to continue living in this level of quality of life, he can ask to withdraw the ventilation, and it's acceptable by the legal and clinical community. In Israel, that cannot be happen. And this is our mission as an organization, to bring all the information before the family and the patient make this decision, because it's legal in Israel to decide that you do not want to go on invasive ventilation, but it's not legal to get off. Once you go on, you cannot get off, and this is something the patient and the family need to take into consideration before making this decision.
So how does it usually affect the family life?
The family life is more homey one. They need to stay next to the patient, or find alternative for people that will take care of. In Israel, it's very common to have lived-in paid help. They need to organize their life around the patient to know that he will stay here for a few hours, a few years in this condition, but the disease will continue to deteriorate. So we are talking about fully paralyzed patient that communicates via a computer and sometimes loses his ability to communicate. And these all factors that need to be considered.
So Efrat, I really appreciate all your answers, and I understand much more the pros and the cons and all the ramifications of it. As a final question, I understand that at the end of the day, these are end-of-life decisions, and they have a lot of philosophical aspects. Could you elaborate on that a little?
Yes, it has philosophical, it has also cultural, religious, faith, economical ramifications. Everything needs to be considered. Our main mission is to put the wish of the patient on top, in front, and on top of all other people around him. And it's to emphasize the right of the patient to decide if he wants to be here for a longer time at a lower quality of life, or he wants to end the suffering and say his goodbyes peacefully to the family and leave this world peacefully. So it's a very, very complex, where me and my team of social workers are dealing with every day with the families, of trying to get to this clarification of what is important. And it's different from family to family, from patient to patient. Everyone has their own faith and philosophical views, and we need to honor and respect everyone and each one of our patients' community.
Wow, Efrat, I feel that even though this is a very heavy topic of end-of-life decisions, we've shed some light on this, and I really thank you for your time and this wonderful interview. Thank you.
Thank you for having me.
Bye-bye.